See, basically, you wanted to know something about syphilinum, isn't it? So, right? Syphilinum is a remedy for OCDs in orthodox prescriptions or in congenital problems. है ना?
Yes.
If a patient is suffering from ASD or something very severe, then we think of syphilinum, right? Just keep this in mind because I'll come to this point later on with congenital problems.
Okay.
Secondly, what is OCD?
Obsessive
Please
compulsive.
don't tell me obsessive compulsive disorder. What is OCD? What happens in OCD? What is going wrong in OCDs? Why we are not suffering? Why people are suffering with OCDs? Because they feel dirt everywhere. There are some people who sit on their own sofa and still they try to wash their hands, wash their pants, wash their face on and off. And there are some people who comes up from railway stations, bus stops, comes in, then they wash their hands. So there must be something, there are two types. OCD is someone who is disgusting. What is OCD? There must be a disgusting fact. There must be a disgusting stimulus on his own life, which he wants to just wash it off, but somehow he doesn't want to. Because there's an impact on his mind subconsciously, which doesn't allow the patient to wash it off. Got it? It may be anything. If at all, at your own house, if your parent, one of your parent, or okay, take an example of a father who is a drunkard, who use filthy, offensive language at their own home. Okay. And now this child, poor child, who is being kicked on and off, been abused, or do whatever the father wants. Now, this child will carry a disgust feeling of his own father at his own place. Right? This father, if at all he sits on this couch and later on he just moves around somewhere else. And this child sits in this on this couch, then he will feel that yeah, my father was sitting in the same couch. Shit, now I have to wash my hands. Got it? This is one of the aspects. See, there are multi-dimensional causes in this cases of OCD. So I'm focusing upon syphilinum I'm talking about. I'm just focusing upon syphilinum because the crux of syphilinum is disgust. Disgust. Secondly, I'll tell you, if at all, I'm in a bus stand, and if I'm a girl, 17, 18 years old girl, and if one of a co-traveler just mishandles or gropes, you know what is groping? The girl, that poor girl, she'll feel, oh God, she is touching me, and there are some situations where you cannot shout at him, you cannot defy her, you cannot cry out for help. You have to just bear it silently. If you're in a bus, crowded bus, and someone is just poking you, groping you, and you are feeling, shit, yeah, what the hell is doing that? That is this impact is formed at the subconscious level of the mind, and then she feels that the whole surrounding is dirty. Even if a man or a 64 years old man just looks at a girl, she feels herself, that man is touching you, metaphorically. Shit. And hence when she gets out of the bus, she thinks, first thing I'll go home and I will take a bath. Have food. No, 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 I won't have food. Why? Because he has touched here emotionally. First, I'll wash this. I'll wash this out. This is OCD of syphilis. I'll tell you how. Syphilinum is a remedy of disgust. I'll share you a case. Once you understand this case, you'll find, come to know what is disgust. A case suffering from warts. You're suffering from warts on the chin. I demonstrated this case in a seminar, national seminar in Jaipur, I suppose. The warts were on the chin. There were only 2 to 5 warts. 3 to 5 warts. So what's a big deal, isn't it? 4 or 5 hours I restaurant my neck is full of warts. I have around 6 to 7 warts on my neck. So that's not a big deal. This doesn't make me embarrassed at all. I can just put off my shirt and go to swimming. I do swimming every day with carrying my warts along with me. I don't feel that bad, right? Think it's bad, but that not that bad, which will prevent you to live life.
Mm.
When he came to me, he told me, Doctor, I just can't tolerate these warts on my chin. Why? Yuck. They're so dirty. I just don't want to. When there was a one wart on my chin, I just went to the skin specialist and just put it off from my skin. Just pulled it off. Okay. After that surgery, the cauterization, within 2 months, I got 2 bigger warts on my chin again. Again, it was just impossible for me to bear these 2 warts. I just couldn't see my face in front of the mirror. I just when I used to see those warts on on the mirror, I just can't. It was so dirty. This is not that dirty. No, actually, it is not that dirty. But that
Mm.
subconscious disgusting feeling is not allowing the patient to stay steady and healthily with those warts. He just wanted to cut it off. Again, he went for cauterization. Again, he was free from those warts. After 3 months, there were 4 warts. These 4 again, he went to the same skin specialist. See the way of disgust, washing and cut it off. Washing, desire to wash,
Mm.
as if the wart was something which was a shit like a thing on his chin, and he just wanted to wash it off, isn't it? And this is how syphilinum uh, gets concern is just to kill it off. Okay, this is how syphilinum presentation in the beginning. It just doesn't want those things. Boss, I just don't want it. So the patient again went to the skin specialist. I again was ready for cauterization, but the skin specialist was a very conscientious physician. He said, "No, 2 times I have already cauterized now, and the cases are aggravating. I won't do it. Better you go for homeopathic medicines." And then he came to me. He came to me and first sentence was, "I just want to get rid of this WhatsApp. Come what may. I'm ready to do anything, but I don't want these things." You know what? She said, "These are so disgusting. So I just can't see it." See, this is simple. Second question, I'll tell you. There was a small corn, and this nail was a bit infected fungally. He told me that somehow I'm not able to look at this nail. I just want to remove the whole thing. I just remove it, sir. Pull it off, whatever. See the kill desire, the syphilitic nature of syphilinum, the killingness, the destruction, the destructiveness of syphilinum comes into matter. I just want to pull this nail off. I just can't see this. This is so disgusting. Again, think of syphilis. This is washing desire to wash. We
Mm.
have a rubric, washing desire to what wash? What wash? Those dirt, the disgusting
Mm.
facts in your life. And if you go very deeply in case taking, if you go very deep into case taking, then you'll understand, then you'll come to know that Disgust is from within, from the subconscious mind. What Dr. Ken Sara showed, we understand the will and understanding. This disgust has been imbibed, impressed, endorsed in his will and understanding. And this is very important to understand. If you want to understand, you can prescribe syphilis just like that. On this disgusting feeling, washing, desire to wash, kill, desire to kill. I just want to finish it off. But if you want to understand the crux of syphilis, the essence, I tell you what, there is strong disgust feeling of a typical person's life. I tell you, syphilinum is made up of syphilis. Well, you know what is syphilis? Have you seen ever in your practice a syphilitic chancre, an ulcer? Syphilitic ulcer, have you seen? Syphilitic ulcer is very disgusting. You just can't see a syphilitic ulcer. Whack. This will be I have, there was a big curiosity, what is that VDRL ulcers? I wanted to see, and then there was a good gynec who told and showed me, see, this is a syphilitic chancre. And when I saw it, it was like, eesh. I would have literally fainted looking at the ulcer. So disgusting, dirt and everything was there. So how does it form? So I'll tell you, reaction. Syphilitic reactions, I tell you. Syphilitic reactions means what? See, you can suffer from, you means, no, I'm sorry, I'm not you, means anyone can suffer from HIV positive, HIV infections, right? It is a sexually transmitted. Most of the times, have you ever seen a syphilitic chancre in a housewife lady? Have you experienced any of that? Most of the time. And it can have been, but the rate is around very, very, very low. Most of the time, the syphilitic chancre or ulcers will observe in prostitutes. Why does a prostitute suffer from syphilitic ulcer? Imagine a 34 years prostitute is waiting for a customer, and then a customer comes who has not bathed for around 5 to 6 days, boozed alcohol like anything, a full pack of manichan in his mouth, totally stinking body, totally body stinking, very dirty customer, and he's paying you 500 rupees or whatever. I'm sorry, he's paying you some money. Of course, that poor prostitute has to undergo the act of sexual intercourse. You imagine what she must be going through when a 64-year-old, dark, dirty, lousy fellow having sex with that prostitute. She will definitely feel, isn't it so? She will definitely feel that dirt, that disgusting. She must have felt from within, she must bath 100 times. Isn't it?
Yes.
This is the feeling of syphilis. This is OCD of syphilis. And this bloody 64-year-old man is doing whatever of his choice on her own body with that disgusting, lousy, stinky smell of his sweat, that alcohol and that everything. And he's just bearing everything out of helplessness. What does she must be going through? That is syphilis. That feeling is syphilis. And the same thing I'll tell you in congenital things. Congenital diseases, I won't comment about congenital diseases because I'm conducting a seminar of suspense nikal jayega. What has to be seen in congenital anomalies is very important. It is very because the process of congenital anomaly starts from the sexual intercourse of the woman. If at all anyone's husband is that stinky, that lousy, that dirty, and having the sexual intercourse with her wife, with his wife, sorry, the same wife will go in the state of prostitution. And the child will definitely need See what I am producing the fruit. This fruit is already rotten from inside, isn't it? This rottenness is congenital anomaly. Got it? So
Yes.
this is how we have to understand. I tell you, congenital anomalies, we'll have a full-blown seminar for congenital anomalies. But this is just to feel how to deal with congenital problems, how to understand for syphilinum, how to understand the remedy syphilinum in this different way of understanding. Now you go back to repertory and read every rubric of syphilinum with this context. Then you will come to know what is syphilinum in and out. Thank you very much.